Hi, CJ Jalise, VM210, anesthesia. This is our canine patient. There is Dr. Jimmy Yu. We have no help today, so we're doing this the best we can. We are using a stand to hold the phone. So here we go. We have already hooked up the IV fluid line. We've hooked up that monitor to the CO2 and tidal. Maybe. That looks pretty good. I need to place my esophageal system. Some lube on our esophageal stethoscope. Where I marked it to, I'll make sure it sounds good. We're gonna adjust. To where we hear it the best. Secure it there. Jury rig this real quick. Just gonna secure that to the ET tube itself. Sorry, securing this esophageal stethoscope. Maybe. Sure, we're still in a good spot. Beautiful.
Can you tell me the heart rate?
96 and 12, sir.
Right. Thank you.
All our machines are hooked up. Dr. Yu is getting ready to start his surgery. Meanwhile, I will be continuing to monitor. Right now, everything looks pretty great except for our CO2 expiration is just a tiny bit high. So every 3 to 5 minutes until we get that back down under 50, we're just going to close our pop off valve for a moment. Please, lungs. And then release.
I could get started.
You are good to go. I'm sorry,
Okay,
sir.
no problems.
Here is where I am recording all of our pertinent information. And we're continually checking everything over here. Everything still looks great. The ECG is wonderful. SpO2 is good. CO2 is still a little bit high. We're at 55, so we're going to keep checking that.
Probably good, you tell them the number, each one of them, not just high and low, so they know. Okay, thank you.
Well, they'll also see my whole report at the
Oh,
end.
yeah,
So.
that's true.
Go ahead and breathe for him again, see if we can get that carbon monoxide down. And release. Still at 96 and 12, sir.
Thank you.
ECG confirms that. SpO2 is at 96. And our now CO2 monitoring is coming down, although it is now to 52. So we're getting close.
Can you write down my program for the
Sure.
So skin is 0.4/30/ST.
Okay.
Sub-Q is 0.4/30/CW.
Gotcha.
Thank you. Surgery started.
blood pressure is 135/89, which is maintaining very well. Going to hit my pop-off valve and breathe through it again, see if we can get this carbon monoxide down. Ah, we finally got it down to 46. Check our reflexes here. Very loose jaw tone. Obviously, hopefully no deep pain sensation, right? Gums are very pink, less than 2 capillary refill time.
Thanks.
And let me just, maybe this will help a little. I'm gonna bring you over here. It's me, there's Dr. U. Just to show you what we are seeing here. You can see my carbon monoxide just went up to 53 again, so I'll work on that. Just to kind of show you everything here and all of its brilliance. What we got going on. There we are. Go ahead and 51, we're real close. You're gonna breathe, 400 again, try and bring that down to hair. Hit my pop-off valve and compress the bag. Otherwise, SpO2 is still at 97 now. CO2 is down to 51. And heart rate according to ECG is still 96. But we will confirm that. .96. Breathing has picked up a tiny bit up to you. I believe it's 18 right now.
Good to know. One of those things that can happen during surgery sometimes. Our cuff popped off, so make sure we're still lined up well with our artery. And
CO2 end tidal is now at 49, which is great. SpO2 is still at 96. Heart rate is at 96 and looks great. We are checking blood pressure again. Checking again for any deep pain sensation. Our jaw tone. There he goes. Check our gum while we're in here. Peak less than 2. Blood pressure is at 130/83. So just slightly dropped from last time. My CO2 rather has gone up again, so I'm gonna breathe. My buddy here. And let go. And we're now down to 44 on our CO2. 95 on our SpO2, and heart rate is at 88, that says. I'm going to check it manually right now. '84 and 18. Jaw tone. Blood pressure is now back up to where we were to begin with, right around 146/112. 84 and 18. I neglected to mention, but he is taking nice deep breaths, which is also something we want to make sure is happening. Check my blood pressure again. Just checking our monitors. Fortunately, he has been incredibly stable, so we have not had to adjust anything anesthetic-wise, which is wonderful. Usually, as we start getting to the end of this procedure, I would be considering whether or not I want to turn down the isoflurane itself. But since we have been maintaining him on 0.2 this whole time, we will keep him there until it's time to wake him up. CO2 came just above 50 again, so we'll go ahead and breathe one more time. Try to get that to a healthier number. There we go. Puts us at a much happier 46. Blood pressure is 129/77. Eighty-four and 18. Matching that, I've got 83 here on the ACG, which looks great. SpO2 is 96, and our CO2 is at 49. Blood pressure is at 126/80. me. It is 110.
Good job.
Thank you. This is gonna mess this up, so I'm gonna need somebody else to keep me up
Yeah, no problem.
because they don't want me to leave monitoring.
I mean, you got solo skip PBM.
So skip it.
Yeah, just skip that. Thanks.
Alright, I'm finished.
You need to stay here, right, when you finish. Until you're awake, right?
Just for a second, yeah.
Sure, no problem.
Uh,
And I'll get the stool.
Actually, if you just want to come right back, that'd be perfect.
Yeah, I'll come right back.
Dr. Yu just left, as you can see. We have finished our procedure. Now we will be monitoring him to make sure that he wakes up well and safely, which is always a big concern for us here. Everything still looks great. And sounds great. We're gonna pause right here.